This horse has a fairly regular rhythm, however, has mild asymmetry of movement of the pelvic region, reflecting a left hind limb lameness, grade 2 out of 8. There is similar excursion of the hind fetlocks. There is no abnormal head movement. The horse sounds regular. On the lunge, there is reduced range of motion of the thoracolumbo-sacral region and lack of swing of the tail. There was a bilateral hind limb toe drag, worse on the inside hind limb. Going to the right, the horse looks more to the outside and is less well balanced. The horse has a relatively high head and neck carriage. When ridden on the left rein, there is immediate accentuation of the left hind limb lameness, now grade 4 out of 8. A shortened cranial phase of the step and a more obvious toe drag. Again, a reduced range of motion of the thoracolumbo-sacral region, and the rider is thrown abnormally high out of the saddle. Again, there is no oscillation of the tail, reflecting the reduced range of motion of the thoracolumbo-sacral region. As the rider goes to the right, there is immediate accentuation of right hind limb toe drag and a switch to a predominant right hind limb lameness. It's important to bear in mind that whatever grade I assign to a hind limb lameness, if it is bilateral, it may not reflect the degree of discomfort experienced by the horse. Following perineural anesthesia of the deep branch of the lateral plantar nerve of the left hind limb, this horse switched to a grade 4 out of 8 right hind limb lameness.
Come down the long side.
It's always important to view the horse directly from behind to appreciate the degree of asymmetry of movement of the hindquarters. Don't stand in the middle of the arena. So this horse has a bilateral hind limb lameness, left hind limb lameness predominating. Bear in mind that with hind limb lameness, ridden exercise may be the only circumstances in which the lameness can be detected. However, a good rider can mask lameness, and a less expert rider may induce lameness, particularly if they are a large rider sitting out of balance. It may be useful to evaluate the horse ridden to a contact versus on a long rein, and compare the lameness seen when the rider is sitting on both the left and the right diagonals, and ask the rider how the horse feels. I think it's valuable to see the horse both in rising trot and in sitting trot, although lameness is often less obvious in sitting trot, but sitting trot may accentuate primary thoracolumbo-sacral region pain. It can also be very useful to evaluate the horse moving in 10-meter diameter circles both to the left and to the right as figures of 8, and as we have seen, performing transitions. So this is a horse whose presenting problem was difficulties in turning to the right. There was no overt lameness seen in hand or on the lunge.